How many of you are covered by Western Oregon University's health insurance? Now, how many of you are aware that insurance is no longer automatically charged to your student account? For the past 7 years, Western Oregon University has required students to carry mandatory health insurance. However, changes in federal health care law caused several Oregon universities to change the enrollment process.
The major change is that we're requiring students to opt in to medical insurance this year, so that if they're not covered by their parents' policies, as they can be now until age 26, they would need to choose to purchase the school-provided insurance in order to have certain medical tests and prescriptions and procedures covered under the insurance policy.
What should the students who are covered by their parents' insurance know?
It would be really important for students to understand the language of insurance. For example, what is a deductible and how much do I have to pay for a procedure if insurance is going to cover the other part of it? Or, for example, what is covered and how I find out what services are covered or procedures or labs are covered.
Is there an example of a situation you can give us?
A great example would be a recent student who was diagnosed with an ulcer and didn't have health insurance coverage at all because that student was used to this mandatory process, meaning that it was billed to his account. And so when he found out that he had the ulcer, he realized he needed ongoing treatment, including medication, but could not approve of that treatment because he knew he couldn't afford the cost of care.
What happens if I don't have insurance?
Would there ever be an instant where a student might be denied medical assistance?
Every student that has paid their $95 student health fee per term has access to medical care, mental health care, and our wellness education programs. So no, if that fee has been paid, we will provide medical services, mental health services, and wellness education for all of those students without question. The difficulty comes when we have an uninsured or underinsured student who is diagnosed with, let's say, an illness or a disease, and then because of their lack of insurance can't afford the fees associated with tests or treatment or medication.
If you're not covered by your parents' policy, one option is term-by-term health insurance. In most cases, this payment is cheaper than a long-term independent policy. Enrollment is simple and can be done online at gallaghercoster.com/OUS system.
We want to make sure that all students know before they come in they need to be insured, or let us talk to them about this process when they're in the office so that if they're uninsured we can find other options for their care.
Health insurance is an issue many students don't think about until they need it. Make sure you take a moment to find out if you're covered.